Mrs. Dash here with me. She's a black Angus heifer. Beautiful. I'm going to be talking about my parasite that I was assigned, which is Fasciola hepatica. It's often referred to as the liver fluke. Fasciola hepatica is less commonly affected in animals such as rats and sheep and mainly herbivores. It usually affects cattle. Humans are usually accidental or uncommon hosts. Fasciola hepatica is a parasitic flatworm that is leaf-shaped. It has powerful suckers at the end of the anterior cone that allow it to attach to the organs of the infected host. Adult liver flukes feed on the tissue while inside the mammal host. Each worm contains both ovaries and testes, which allow them to produce eggs independently. Liver flukes reproduce both sexually and asexually, and adults are capable of both cross and self-fertilization. The life cycle of Fasciola hepatica starts off with eggs that are separated from the fecal material in usually wet areas. They then hatch, releasing the larvae. Once they are hatched, they invade mud snails and use them as a temporary host. They then multiply and develop into tadpole-like parasites. They swim and make their way into vegetation areas such as grass. From there, they are ingested by the livestock, mainly being the cattle, like my friend Dash here, and they eat the contaminated water, and then the host is infected. The life cycle takes 2 to 3 months once it's in the field, and once ingested, takes 6 to 7 weeks inside the host before they become adults. The diagnosis of Fasciola hepatica is hard to identify before a full 4-month cycle of the larva. Eggs are usually present in the stool of the infected host, and another way to identify the parasite present would be using the ELISA test. It can identify infestation of the liver fluke as early as 2 weeks after being infected. False positives are common due to cross-reactivity, and the best time to test for positive treatment using the ELISA test would be about 6 to 12 months after the host has been infected. An ultrasound is another common method to use to find adult flukes in the bile ducts, and also CT scans are a great way to detect them as well, because you can see the burrow tracks that are made from the worms as they're burrowing through the infected host. Prevention and treatment for infected animals depend on the nature of the disease, and some anthelmintics are not effective against immature flukes. They are also not recommended for any acute outbreaks of Fasciola hepatica. 2 treatments annually of fluke S or C are required on properties where sheep and beef are present if the liver fluke has occurred. The first dose should be given during spring and followed in the early summer, and a 3rd dose should be followed in the early fall if there's heavy infestation of the liver fluke. Clozicum is used to kill a portion of the fluke that is aged 6 weeks or older, and the immature fluke will become retarded in their development, and it will halt their production of eggs for several weeks, and it'll reduce the level of pasture contamination. And thanks for having me. That's the end of my presentation.